With regard to there being higher rates of COVID-19 mortality in the Black community and a higher possibility of contracting the infection, it is clearly understandable that this may cause some fear within the community. On top of this, there has been some misinformation circulating within the community as well. How can we reduce this fear, or how can we address it within the Black community?
So one of the things that I think we should do is stop. When you get a WhatsApp, stop sharing it. You know, it has its challenges even in where I live, because in my own home, there's people in there that have different opinions, you know, and I've decided I'm not going to be looking at things that people are sending me that are not correct, but people are still passing it on. And if you pass it on, it makes you just as bad as the person that is sending it, you know, because you just, like, people that have mental health, you know, they have an element of paranoia. Some have that element. And if you send information around that's not true, I find that people believe it, and it's not harmless. You know, we've all got a responsibility to not do that. You know, people might look at it and think, oh, well, it's only a WhatsApp, but it may just be a WhatsApp to you, but to someone who's at home on their own, you know, that has no support, that can make them really frightened. I mean, in our community, one of our members passed away a week after we closed. And I can remember him coming in to work, and I said, look, you really shouldn't be here because you're one of the high risk people. And he was like, I'm really hungry, I've just come for some food. So I said, hold on, let me just get you some. So I put his food in a bag and off he went. By Wednesday, he had died, because I was trying to say to him, follow the guidelines, please follow that. You have got underlying health conditions. And he was just so adamant that it wasn't true, this wasn't happening. And I got the biggest shock. He died, you know?
Yeah.
So we just have to be so careful what we're saying.
Absolutely. And just picking off of that point about the guidelines, how do people feel about the guidance that exists at the moment from various authorities? Do you think that it is accessible to the BAME, to the Black community in particular? And what is a way that you think might be, for instance, if you don't think that it is entirely appropriate, what is a way that you think might be more appropriate for a better reach within the Black community? So this is guidance around the social distancing measures, the kind of hand hygiene measures, the new guidance that is updated daily, essentially. Leah, can I bring you in here?
Yes, of course. I suppose I'm part of the system that creates some of that guidance, so it's a little bit wrong for me to say that it's not accessible, but I do understand that it isn't always as easily understandable, or I think we've seen quite clearly on the press briefings how guidance can be interpreted very differently by people. And the guidance that I know that PHE, for instance, Public Health England produces, that also can be interpreted quite differently for people. I think it's an obligation for government and any organisation that is putting out guidance to ensure that it comes out in a way that people understand, it's accessible to each and every individual who it needs to go to, whether that be languages, or whether that be in the tone and tonality in which people are speaking, or in the same medium that people use a lot of the time. So whether, you know, WhatsApp or, you know, other means as well, it needs to reach people where they are. And I think we have been a bit remiss sometimes, in terms of public health bodies, in making sure that happens.
Thank you, Leah. If I could please, oh, was that someone trying to say something?
Yeah, I was going to say something. I think that providing alternative messaging is really critical in languages that diverse communities engage with, and the mediums that they engage with, which is the sort of latter point. But I think actually even the construction of those messages needs to be done by those people who understand what is receivable by those communities, because actually the fear piece that we're speaking about earlier is very understandable. If you're in a society, as we've noted from the whole worldwide response and resonance with many Black communities across the world, and you're in a society that's dealing with systemic racism, actually your whole experience is about that kind of surveillance, that kind of systematic racism on a day-to-day basis, the stop and search, the differential treatment in many public sectors, be that housing, be that employment, be that in education, be that in health. And so actually some of those fears are based on a reality, and we don't want to be thinking here that people's fears are based on an unreality, because actually it's them making sense of the oppression that they're experiencing on a day-to-day basis. So I think that that's really important to understand. That said, some of the manifestations of some of these messages that are going around actually can be challenged by providing alternative ways of understanding the experience, and that's the kind of messaging that needs to be developed. And we're actually doing some of that work within Lambeth, where we're working with the communications via Black Thrive to actually really look more closely at what kind of messages that we're sending out to people. And there was a really good little pocket of good work that was taking place in my portfolio amongst youth offending services and the clients that use that service, whereby day in, day out, they're getting all these conspiracy theories and other messages and really believing them. And what the workforce did was immediately find information that would challenge that would help them to see that differently and have those conversations immediately, which helped to help people move towards a more fact kind of based kind of like thinking. Not to say that all the facts that emanate from public health, for example, is gospel. It might not be, because even as we can see with the COVID, there are differences in how all the scientists are viewing when we should lock down, if we should lock down, where if the virus is rising or not, whether we should, so actually people's suspicion, and suspicions is the wrong word, curiosity and wariness is appropriate, but we can use that as an avenue to have better, thoughtful conversations, I would say.